Hello and welcome to another episode of the FemiNinja Project. And thank you so much for tuning in. You are going to love this episode. I have a fantastic guest with me. His name is Dr. Tommy Rhee, and he is a nationally featured sports chiropractor, regenerative medicine innovator, author, and speaker who is known for challenging conventional healthcare and introducing non invasive, needle free solutions for healing and performance. I know I've got your attention. He is the founder and CEO of Rhee-Gen, a patent pending cell free regenerative platform focused on topical biological signaling rather than injections. His work sits at the intersection of sports medicine, biotechnology, and the future of human performance. He is the author of the book titled The Future of Regenerative Medicine: Unlocking the Potential of Topical Stem Cell Therapy. He is also a Navy aircrew veteran. Dr. Rhee, thank you so much for being here and welcome to the show.
Oh, thank you for the opportunity to talk to you and your listeners.
This is so exciting because, of course, we're all talking about regenerative medicine and stem cell. Everybody's heard about it, but going topically. So tell us how this all came about.
Well, it starts with the journey of me working with these athletes from all the way from UCLA. And then, of course, those are elite athletes. And it's all about, recovering from an injury or a workout. And then you start seeing that type of recovery. And, when you're young, it's not so much like, getting back because the tissue's young. But as these kids get into the professional world, then you see their protocols of how they get themselves back into 100% mode. And then that's how regenerative medicine was introduced to me. It was in the form of injectables of things like sugar water, PRP, where you draw your blood out, re-inject your body for that area that you may have a damage to heal faster, and then stem cell therapy. But it's always with injectables. So the tough thing with injectables is that if you're in the season, you have downtime from the injection because think about what you're doing. You have an injury site, and then you're gonna, put a secondary injury site with the syringe or needle. So now you have to recover from that needle. Well, athletes can't do it during the season, especially football players, because their game is like, every week. Basketball players too. They have two, 3 games in that week. So the problem is that they can't do regenerative medicine during the season. So what they do is they go into the pain med world. They just mask the pain to, allow them to play the sport.
Mm-hmm.
So with that, there was that void that I saw. And then with that, you have to really understand what stem cell therapy and what the information you're trying to get. And once you understand the concept of stem cell and the mechanism, it's not so much the cells, it's the signals. It's these little things called EVs, extracellular vesicles, that sends out these signals to your existing tissue to do its job, to actually like regenerate. So once you understand that principle, now you're looking at that type of like that cell-free molecule. Then what you do is you find some transdermal agent, and that's what I found. And now you can do a topical application that does that delivery mechanism, goes to the deep tissue, and then voila, you're healed. Now the best thing about there's no downtime. There's no, in fact, injection site that gives you the injury site.
Mm-hmm. Now, I love that because of we all know, well, we do now, how permeable the skin is. And because people are probably thinking, well, how do you get it, into the area of injury if you're just rubbing something on your skin? But the fact that, it goes into the bloodstream so quickly and directly to the tissues rather than traumatizing them more with needles.
Yeah, because now there's like 3 layers of skin, and the first thick layer that we have is what they call the stratocordium, that thick layer of skin. But it has this permeability ability if you just disturb what they call the bilipid layers. And then there's an agent that we utilize in the topical that breaks that up so it can carry those small molecules, the cell-free molecules, through that little area and then down deep to the tissues. So once you get that principle done, and the neat thing about that, it's utilized right now in the FDA world for delivering, drugs in that manner. And then I just translate it into a topical application where it's now easier, friendlier, and more important, it's up to the patient to apply it on themselves instead of going to a doctor, to a clinic, and you're applying it at home.
Hmm. Now, how long has this product been on the market, or is this still something that is a work in progress?
No, no, it's on the market now. Now, because of this, because of the donor side is from the umbilical cord or what they
Hmm.
call the Wharton's jelly of that area.
Hmm.
It's a human tissue, and I can't sell it directly to the patient, so it has to go to provider. But if you just ask your provider, the provider calls me up, and then I can give it to them, and they dispense it to the patient. So there's a two-step mechanism there. But here's the important thing right now we have to understand is that the signals is what we're trying to achieve from that site, right? And then that's a signal that we want our existing tissue to have that information to do its job. Well, there's plant-based stuff that does as well as this type of information is coming from this human source. So once I am capturing that type of message and I understand real delivery mechanism, how I can do everything without that FDA type of product or the human tissue, now I can go right to the consumer as an OTC product, and now I can ship it right to them. The neat thing about that, because the source is that the cost is a lot cheaper, less than $100. And it does as powerful and same type of signaling as this tissue that's costing, injectables 5,000, the topical about $1,000. Now it's like less than $100.
Wow. So just my husband actually had terrible knees. He was an athlete and wrecked he beat his body up pretty well. And we actually did do stem cell therapy, because we were trying to put back and hold off the knee replacements. And I was actually shocked at how traumatic it was, for the tissues and stuff. And I thought, oh my goodness, he was in so much pain and he really didn't get any benefit from it. And it was so invasive and so intrusive.
Yeah. Now, here's a funny thing about these clinics that, they're advertising stem cell therapy or I've got live cells. I got 10 million live cells are
Mhm.
offering these live cells. What live cells are cells that have that nucleus, that chromosome and DNA component. Well, that's information. That information is coded to do something. So if you inject your body with this information and it's a live cell, it's going to cell divide. It's going to multiply. It's going to do something. Now, what's the chances of that chromosome, those codes, right, those genetic codes, match your tissue?
Mhm.
Impossible. So it's going to do something else. That's where the danger comes. Now you're looking at possible tumor formation, irregular growth. You have to be aware of that. But you have to take the next step down, which is the signals. The signals, and that's why you want the cell free. There's no DNA. There's no type of possibility of it to turn into, whatever it's meant to, because you're just looking at the signal. That signal is like proteins, cytokines, you
Mhm.
know, little bit of information that we get from just like a hormone system, right? You have something that comes from the brain, target tissue, it's a signaling, right? And it's a longer pathway. Well, this is a shorter pathway because you're doing what they call the paracrine effect. It's almost like that cell to cell information unload. So that's why this is more exciting.
It's very exciting. Now, I have to ask, how did you come up with this? Or what was the process? Or did you just wake up one morning, 3 o'clock in the morning, going, aha, I think I've solved this problem? That's usually where I have my insights. But how did you do that? And what was the process like? I mean, I know that with your background as, in the military, that you have a certain process, very meticulous, that you always, do in maneuvers and stuff. So did you apply that to this
Yep.
process as well?
Yeah. Great point. Military sets the standards. It sets the standards from starting to where you're trying to discover something and you have a
Hmm.
question. It's all about answering a question. So when it starts off with an athlete and they're doing this regenerative medicine, stem cell therapy, but they don't know the principle or the mechanism. So you just can't be a good provider and say it works. You have to show the steps of it. So I provided this injectables in my office. And then here I am just understanding it in a basic term, just like everybody else in this provider world. But the problem is that you really want to be a better provider. My job is to educate patient. So if
Hmm.
I don't know what's going on, then how dare do I tell people to do something without my understanding of this? So that got me involved with researching and pulling out what is really going on. What is this mesenchymal stem cell, and it's supposed to differentiate into these tissue, right? Into the target tissue. Does it really do that? So the science doesn't really say it does that exactly. It has some type of like, almost like a uh, transparent kind of possibility of maybe it does, and it just does something, right? So then you take the next step, and then you think about the signal. The signal is what's really important. And then now you're starting to see more and more papers and research indicating about the signal. That's why you're hearing these things about exosomes and these type of like peptides, information, signals that are giving to your existing tissue to do something. So once I understood that concept and then understand that I have to take those processes that I learned in the military of just like starting one step and work my way into the final destination, which is the knowledge of what really goes on.
Hmm.
Now it's my job to relay that to patients. And with that, I started seeing that, hey, if I can get something to deliver instead of the injectable way in the topical way, that's how I learned it. So this is a process that took me, oh my gosh, I started this thing in 2007, learning
Oh,
about
wow.
this regenerative medicine and learning about the evolution. And I'm in the market, I'm in the world, I'm seeing this evolve. And the one thing that was the factor was that it's all injectable. So
Hmm.
learning that process and then understanding if it's just a small molecule, the signal, and it's small enough that you just need a transdermal agent that, from a topical application goes to the skin, it's going to do the same job. And once you understand that, now it's just basically delivering, developing it, and really understanding the pieces that kind of put it all together. And then voila, there's that product.
Well, and you don't have to worry about things like possible infection sites, or or infection from the injection site, or some other type of adverse reaction, or whatever. If it's something you're just massaging into your skin.
Yeah, because that's the biggest thing is that when you get invasive injections, surgery, everybody's at a risk of infection. That's the worst thing. And that's why when you do like a needle draw or blood drawn or something like that, they clean the area as much as possible. But sometimes it just takes one little bacterium or virus and then there it goes, right? And then if you're immune compromised, it's going to really take its toll on your body. So that's a very important one. Another thing that's kind of interesting where this trend is moving to about the ethics of stem cell therapy
Mm.
is a donor site. The donor site is an interesting thing because right now this is coming from a C-section delivery and the umbilical cord that Wharton's jelly.
Hmm.
Well, you have to vet the patient and then you're asking the questions about family history, doing the
Hmm.
serology, doing the pathology, and making sure they don't carry any diseases so it can translate to you, right? So that it's a long process. Well, because of this more of a expansion of clinics and there's more popularity to it, well, the supply is more demanded, right? So now you're starting to run out of this tissue. So these labs that are getting popped up here and there, well, the problem with that is that there's no regulation. There's no real regulation when it comes to the clinic side. So then
Mm.
there is regulation on the FDA side with the laboratory, and they're being shut down left and right because there are stories of these donor tissues, not human tissue. They're like bovine, pig.
Oh, oh.
There's animal tissue that's given because the end user, you're just getting in the vial, and then you're supposed to take that and trust the lab and goes, okay, inject the area. So that's why it's getting kind of like the FDA is going to come down a little more. It's going to be
Hmm.
regulated, and I believe it's going to be regulated in the sense of in the pharmaceutical drug classification. So we're going to start slowly seeing that pattern. But the neat thing about that, if you look at the EVs, which is what I have, that's not controlled. There's no danger to that thing, and it's not invasive. There's no needles. You're not penetrating a needle into the skin. It's just going to go through the actual skin, and then that's how it gets down to the deep tissue.
I'll bet your patients just love that.
Oh yeah, I mean, especially the ones that don't like needles. And really
Right.
the really who loves it are the people that are active that don't want to slow down. Athletes,
Hmm.
weekend warriors, everyday people. I mean, they just want to go ahead and do something while they're in some kind of work atmosphere that,
Hmm.
inhibits that pain and slows things down, but also heals the tissue.
Hmm.
So that's what's important is that it's not a masking agent. It really goes to the source and heals that tissue.
So I have to ask, as an older adult, I'm not an athlete, but I am a dancer and a martial artist, and I do a couple of other things. And as we age, we know we're told, "Oh, you can't do these things anymore, and once you get an injury, you're never going to recover," and all the other stupid things that they tell us. So how does this work with somebody just like myself? I'll be 70 in September. I can't believe I'm saying this in online. But I want to keep being able to do the things that I love to do.
All right, so you have to think about what your body's going through. There's a whole process that we have to understand about ourselves. And then it's all about that cycle. Our body always recycles, right?
Hmm.
New in, old, out, right? And it's a 1-to-1 ratio. Once you get past puberty, you got that 1-to-1 ratio of like destroying and rebuilding. So you always get fresh tissue and it's coded to its correct type of like workability.
Hmm.
As we age, our signal decreases. So as we destroy, our signal rebuild starts slowing down. So the ratio starts turning like maybe like one build to destroy, or to destroy one build.
Hmm.
So the signal doesn't keep up that 1-to-1 ratio. If we can just get something in the form of that information, that signal that keeps up that ability to have that 1-to-1 ratio, your 70 is going to be at 110. You just need that information. Then you have to think about what's the target tissue. The two target tissues that we want to go after is, of course, the tissue that's damaged that needs to be recycled, right? So it needs a signal. And there's adult stem cells. These adult stem cells we have in our body don't have that information to do its job. So then you have to say, all right, give that signal. But the other side of it is that these stem cells, these adult stem cells, they have chromosomes. They have what they call at the end of the chromosomes, these little thing called telomeres. We all know what telomeres, that's a little buzzword out there, just like stem cell. And that's the secret out there. Once you start going to this, replication of cell division, you have so many times that you can do with this RNA, DNA replication, go through mitosis and cell divide. You have so many of those things. At a certain point, we kind of like get these telomeres to chew down every time it cycles in and then it starts dividing.
Hmm.
When those little telomeres drop down to a certain level, it tells a chromosome stop replicating because you don't want to have miscodes. If you have miscodes, tumor formation. We don't want that, right? So that's our safety mechanism. But the problem is that it's not doing its job. So it's like we need something to increase those telomeres back to its normal length, and then it allows us to do that replication of cell division. Well, this information that we're looking at, the signal, is, all forms, and there's an enzyme in there. And the enzyme is called telomerase. Telomerase increases telomeres. Once you get that enzyme back in that cell and it increases those telomeres, well, now you're ready to replicate. Now it's out of that state called the zombie state or a senescent state. Now you're ready. Now it's sitting there and it needs information. Here comes the signal. Do your job. Now it's going back to its process of becoming 1-to-1 ratio. So that's all that's what it's about. You're just trying to get that secret. And that secret is in the form of that signals from that source.
I'm really curious. Do you include this explanation in your book?
Yes. So the book, that's the reason why I wrote the book. The
Hmm.
book was my savior because I would have these questions over and over again. And then I said, let me write a book. The book would explain everything that I talk about. So that's why the book is interesting because it has a scientific side of like what are stem cells, different type of stem
Hmm.
cells, what is it doing, and the mechanism as far as the signaling and moving on to the future, which is the topical side of it.
Hmm.
But then it gets complicating for someone that's not in the science side of things. And
Hmm.
then I have Jeff. Jeff's journey is pretty much summarizing in the layman's term what this terminology means. So you can follow along Jeff's journey to like understand what different kind of stem cells, what do they do? What is this differentiate? What is totipotent? What's multipotent? What are these different kind of stem cells? And then find out what the topical side of it, and then finally understanding that that's the path I want to take. So it's a real simple kind of book for that kind of version. Or
Hmm.
you want the science side of it with a lot of cited sources and a lot of references, you've got that in the book. It's a
Well,
short read too.
thank you for clarifying that because I did look up your book this afternoon, and I was like, Jeff, who's Jeff? I was like, no, that can't be right. So okay, got that question answered.
Jeff
And
Jeff is a Jeff is a perfect he is everybody at age
mm,
50. Everybody age 50, we all go through something that the doctor scares us, right?
yep.
Person you go to an orthopedic goes, "Oh, you're about to get knee replacement. Oh, you're about to get surgery. You're about to. I hate to say it, but in the medical world, there's not that much choices there. It's either
Hmm.
medication or surgery. Well,
Hmm.
in this world, in my world, it's about letting your body do its proper job by just introducing these signals to do its normal function.
Hmm. Well, the body has an incredible capacity to heal itself. And you're preaching to the choir here because at the age of, I was in my mid 30s, I had a horrible injury, back injury, and it was just kept getting worse and worse and worse, spiraling out of control. I lived with it for 2.5 years. And it wasn't until one of my doctors told me that, I was never going to get better. I was always going to be a chronic pain patient. I would never have the life that I had before or the life that I wanted. And to start applying for disability because I was going to need it. And I was 36. And I just looked at her and I said, "You don't understand. I'm planning on going back to ballet class." And she laughed in my face and said, "No, you don't understand, but don't worry, we will take care of you."
Yeah, that's the
And
classic.
and it
You
was
know,
just like I went home, I hit rock bottom, and finally I had one of those mental head smacking moments. It's like, wait a minute, they're making me worse. And that it was hard for me because I was trained in Western medicine. I was a respiratory therapist. And then I ended up going back to school after that fiasco and got my master's in PT and was really horrified at, the PT end of it and how everybody is treated like a number, a diagnosis. This is the diagnosis. Okay, here are your exercises. Everybody does the same thing. And so that's why I was really curious about there was something in your bio that you were talking about, exercise and some why some people actually get worse and why exercise can actually injure you more than help you.
yeah. Don't forget, like everything is very like structured as far as the ability to have your joints move in a certain way.
Mm-hmm.
So the worst thing that we were taught when we were young is no pain, no gain. And then
Mm-hmm.
that biofeedback that we have to listen to is not like one of those things that you have to say, okay, shut it down, or fight through it. You have to question it. Goes, what am I doing? Why am I having knee pain? Is it knee pain from soreness, or is it knee pain from like a compromised ligament or a tendon or something, right?
Mm-hmm.
So that's the first information you want to gather, and seek someone like myself, like you, that understands about anatomy, biomechanics, and then start with that pathway.
Mm-hmm.
The tough thing with that is that, you always try your best to understand what the Western medicine's all about. They have their purpose, but you have to look at the big scale, right? The big scheme of things. You have to look at what they're really about. And sad to say, it's like anything else. There's a business involved with it, and the
Mm-hmm.
business is run by the pharmaceutical world. You have to look at that. Why do they want that medication? Why are they always suppressing us?
Mm-hmm.
Simple exercise, but then again, proper exercise. You have to understand your limitation. You have to understand that as my age, I'm not going to be jumping off of these plyo boxes hard anymore. But I can do things that do still tax that particular muscle. If you have the right biomechanics and understand your limitation, because, you know, I'm never going to be a 20-year-old guy that can just jump out of the back of a pickup truck, right? But I can still do the same mechanism of movement from other exercises. And that's all it's about. It just keep moving and keep pressing that body, but being in a good mechanical way. So when you start having that kind of like exercise and it's getting compromised, you have to find someone like me to figure out, are you doing it correctly? Find a physical therapist. Even some personal trainers, they know biomechanics. They can see, goes,
Mm-hmm.
okay, your back is rounded when you do a squat. That's why you have low back pain. Use your
Mm-hmm.
legs, core stabilization. The things that you hear, the buzzwords out there. The hard part is that being disciplined to do those homework, do that
Mm-hmm.
exercise, like really be cognizant. Because nobody lives in the future. Everybody lives in the present. Goes, oh, well, I'm hurt. But you are hurt. Everybody's hurt in the immediate sense of acute. But it's the repetitive injury that you want to prevent. You want to say, okay, I'm hurt now, but how can I prevent that from the future? And it's proper exercises. And there's other things too besides just exercise. There's a diet component. And then more importantly, stress. Stress
Mm-hmm.
is a very tough thing to understand because nobody really understands stress and they don't understand what it does to your body. So
Mm-hmm.
those three factors are what they call wellness. And then if you know that component of it, your body and your soul and your whole entity just goes further in the future, better, active, and longer.
And I have to add, it's so empowering when you can understand your body and you listen to it and you can respond in a way that helps to build yourself back up. That is just it's such a great feeling that when you can help yourself, find that homeostasis and the way of moving that actually feels good and is no longer beating yourself up.
Yeah. That's why right now, this time, right now, as we move forward, information is so abundant to anybody that have internet or Wi-Fi or
Mm-hmm.
whatever, they can access information. Like, for instance, this show. This show is a great conversation to have to start somebody thinking like, hey, why can't I do that? I heard about this. There's Chat GPT, there's Google, there's all this sourcing that you want to doubt your doctor, doubt me, this conversation. question it. I'm one that always have my patients say, hey, let's both look at this so you can understand what I'm thinking. Because sometimes you don't want, when I'm doing patient care, right? You don't want the patient to start questioning you, say, do you know what you're doing? That's why I just educate them. This is your
Yeah.
anatomy, this is your biomechanics, this is your problem, and then we're going to take this pathway. Does that make sense? Because, okay, understand. Once they're on your side, therapy
Mm-hmm.
goes easy. Everything goes easy. There's nothing worse than you go to a provider or a doctor and they don't say much, take this needle, walks out of the room. You have all those questions not answered. So now you're basically wondering, is it really understood? Does he know what's going on?
Mm-hmm.
So that's what's dangerous right now is that these providers are kind of like taking that old mentality of like, just listen to me, don't question me, just do what I say. But now with all this information and these sources, oh, it's in the hands of the patients again. So that's what's fun about it. Now when you look at that, they understand, well, they'll understand regenerative medicine. These things that we have to do is rebuild our tissue, elongating, do that biohacking, they would say, right?
Mm-hmm.
But learn about like how to understand about everybody's going to have a different anatomy. So I'm not going to squat or bend or something same as you, but I can do things that engage the same structures that you have.
Hmm. And there are so many resources out there. Like you said, all you have to do is go online and look up anatomy, sites or whatever. And I've found a few online that are actually really good and explain things in a way that are just very, very thorough and, accurate, but easy for the layperson to understand. I mean, you don't have to get a PhD, in anatomy or physiology, but to have that kind of level of understanding of your own body, like I said, it's so empowering. And as a patient, when you go to a provider, you already have that knowledge that you could explain to your provider, well, this is what's happening. This is what I think it is. This is what I've tried that didn't work. And this kind of works, but I'm not really sure. And then you're working together as a team.
Yeah. I like it when a patient comes into the office and I start off with just a layman's version of the anatomy. Now,
Hmm.
once they understand or they are knowledgeable and they want to go ahead and take the next level up and really talk about the physiology and what the mechanism need, that's where I enjoy it. Now he's on my page. Now we go into it. Now we talk about the actual like structure and the biomechanics and look at really what's going on. Talk about the ACL. How do you
Hmm.
really compromise the ACL? You know, and there's some athletes that don't have an ACL. So they understand why, because it's about the muscle to replace that ligament. So it's
Hmm.
about structuring that joint. So I enjoy those conversations when people talk on that kind of like knowledgeable level of that joint.
Hmm. So, let me see. Where was I going to go with this? Ah, it just popped into my head and then it just flew right out again. Just tell us a little bit more. So, is this product I mean, can people buy it now or are you still in the processing?
No, no. So yeah, it's on the market now, but I have to have it like, for instance, like if you can go on my website, it's regen.com and you can
I love
understand.
that, by the way.
Thank you very
Regen.
much.
I love the play on words with the last name. That's
Yeah,
great.
look, that was awesome. Like somebody pointed that to me. I'm like, oh, that's interesting. So then I said, yeah, that is interesting. Apples are apples. Let's make it work.
Yeah.
But you can go online and you can read about it. And then when you find that maybe this is a great option for you, talk to your provider. Your provider will contact me, and then I have to, 'cause there's products in there or there's ingredients in there that have to go through a provider because it's professional use only.
Hmm.
But again, like I was saying, the signals is what's important, and I'm developing a new regen that goes straight to the consumer. So there's no more middle person, the doctor, and the cost is so much more inexpensive.
And when will that be available?
Okay, so now so we're past the formulation, we're in the testing phase. I feel around August, but you know how I'm like a contractor, I'm done in 30 days, give it really 2 months later. So I mean, we're gauging August, so it all depends on these little tests. You've got these tests. It's called a in vitro permeability test, and
Hmm.
we've got this other test, a stability test. It's just all these tests that you have to make sure that the what you're claiming and what you're saying is actually working. So August.
Okay, so would you do me a favor and make a mental note so you can contact me in August or whenever it is available? So if you want to come back on the show, we could blast it out again, and I could just put on my social media, blah 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 blah. I can get a jar and say, look, it's working for me. That type of thing. I would love to do that.
Oh, 100%. I would definitely do that. In fact, you just went to the top of the list with that little statement. I
Well,
mean, my
thank you.
list is real short, so it's like, yeah.
Well, I always do aim for the top. So,
Awesome.
so Dr. Rhee, where can people find you? How could they get a hold of you if they had questions or wanted to maybe shoot you an email, your social media, any of the links that you can share with us? It's in the show notes already and will be forever, but I really like for my guests to be able to articulate where they can find your book, that type of thing. Anything you want to promote, now's the time.
Yeah. Okay. So again, on my website, reegen.com, you'll learn about stem cell therapy and the topical version of it. And then in there's an info button. Click on that. You can shoot me an email and then ask me questions. Social media, just use my name, Dr. Tommy Reed. You can find me around there. I'm not really like, active, but if you send a message,
Mhm.
I'll get it. And then my book, The Future of Regenerative Medicine, easy read. It's on Amazon. And then just The Future of Regenerative Medicine, and then my last name, Rhee, and you'll see it pop up. And then just like that, click and go.
I love the way you say it's an easy read for those people who are listening or thinking, wait a minute, this sounds way too complicated. But yeah, no, it's just an easy read. Just sit down with a cup of coffee or a cup of tea and,
You know what it
it's,
is? It's a good party trick. You're going to a party, and then you're going to ask people, "Do you know what mesenchymal stem cells are? Do you know what a Wharton's jelly?" You can throw that out and sound like you know what you're doing, I guess.
yeah, and be the life of the party, I guess. So, Dr. Ray, this has been a wonderful treat having you on and hearing this story. And I know that the listeners are just their brains are going because it's like what a wonderful thing that you're providing. So, do you have any final? You've given us so much great information. Do you have any final pearls of wisdom or one little thing that you want the listeners to maybe think about before
I
we
think the
sign
biggest,
off?
yeah, the biggest thing is that, we are in a neat like time frame right now with so much information that we can obtain ourselves. And don't believe that, 80 and 90 is that end stage. We're going to start pushing 110, 120. And not just that kind of age. We're talking about active at 110, 120. And it's just understanding, get it down all the way down to the molecular and the cellular level and understanding that. And then it'll take you to that age.
And going the natural route rather than the invasive, intrusive injections. And I'm sure they're great when you need them, but I would
Yeah,
rather just do it the other way.
absolutely.
Well, thank you so much for being here. I really appreciate it. I know you're a very busy man. You got patients to see, so I really appreciate it. Thank you so much for being here.
Thank you very much and the opportunity to talk to you. What a great conversation. That was fun.
Thank you. And everybody, thank you so much for listening. And please share this episode with everybody you know. We all need a little bit of help as we mature, and we want to make sure that we stay active, healthy, fit, and flexible our entire lives. And so don't listen to those people who say, oh, no, you can't do this because you're getting old. You're not. We're not getting older. We're just getting smarter, and we are getting better. And that is the way of the FemiNinja.